Good afternoon. I'm Benjamin Keller, and this is my leadership assignment in partial fulfillment for Nursing 546, Healthcare Ethics, Law, and Policy at Colorado State University-Pueblo. First, a little bit about this project for this class. I drew on my experience in nonprofit leadership, healthcare, and nursing education, and I wanted to create a shovel-ready plan. I wanted something that would create economic benefits for a local community while reducing healthcare disparities and costs and increased the number of nurses. So I drafted a strategic partnership proposal. This is a three-way academic practice partnership with the goal of creating a rural nursing workforce development pipeline for Pagosa Springs Medical Center. Why Pagosa Springs? The target audience for this presentation would be the leadership team at Pagosa Springs Medical Center. The data presented here in this presentation is specific to their current economic reality. Still, it could easily apply to almost any critical access hospital that has been hit by declining revenues, Medicaid cuts from the Big Beautiful Bill, or increased costs associated with staffing, inflation, tariff, or other factors. Some of the key metrics for Pagosa Springs Medical Center are as follows. They have 11 licensed beds. They are an ER level 4. They're facing a $3.1 million anticipated operational deficit for this year. 18% of the children in Pagosa Springs and Archuleta County live in poverty. It's 55 miles to the next closest hospital if PSMC were to close. It's 2.5-hour round trip to Fort Lewis College, where a potential nursing student from the community might go to nursing school, and 61 years is the average age of the resident in Pagosa Springs. In short, Pagosa Springs Medical Center is a vitally important critical access hospital that needs some attention. Pagosa Springs struggles with three key problems. The first is nurse recruitment, the second is financial instability, and the third is regional housing costs. Looking at recruiting and vacancies, rural hospitals face chronic workforce shortages and financial instabilities. Workforce development pipelines targeting high school and EMTs have found traction and success, according to the American Hospital Association 2026 Rural Nursing Report. Traditional recruitment often fails. Costs associated with hiring a single nurse can be more than $60,000. Rural nurses, especially those from the community, have been shown to be more likely to remain in their communities that they are recruited from or work in rural nursing in general in comparison to those recruited from urban environments. And finally, Pagosa Springs Medical Center has a high cost of travel nurses and housing affiliated with Pagosa Springs. There's a significant lack of affordable housing, making recruitment outside the area significantly more difficult. And this was found through a number of studies that the City Council had commissioned to look at operational costs associated. In short, studies show that creating a locally trained nursing force can stabilize costs, improve care, and strengthen the regional economy. Pagosa Springs Medical Center needs financial stability and sustainability, so the goal is to create a sustainable healthcare workforce for Archuleta County. Although the initial phase of this proposal focuses on nursing education, the benefits extended to allied health professionals, EMS personnel, and other providers make it worthwhile. In short, we want to create a sustainable healthcare workforce for Archuleta County. It's not a new program. It's strategically leveraging new partners and best practices for growth and workforce stability. I'm proposing a three-way strategic academic practice partnership to create a classroom and high-fidelity simulation lab at Pagosa Springs Medical Center. This will enable clinical nursing courses such as Introduction to Assessment, fundamentals, med-surg, maybe pharmacology, to offer clinical lab experiences while students reside in Pagosa Springs. If desired, the lectures for these courses could be delivered remotely, reducing the cost of employing multiple nursing faculty in the Pagosa Springs area. Here's one concept of how the initial partnership could be arranged between Pagosa Springs Medical Center, Pueblo Community College Southwest, and CSU Pueblo. Each one of these partners brings something special to this program. Pagosa Springs brings the classroom space, in-kind contributions, and it serves as the local geographic anchor and face. PCC Southwest brings existing EMT, pre-nursing, ADN, and similar programs, as well as an existing dual enrollment relationship with CSU Pueblo. This would be adding a new clinical site for them. And CSU Pueblo brings rural partnership know-how, grant coordination, support for BSN attainment to develop nursing leaders at Pagosa Springs Medical Center, MSN educators for program stability, and nurse practitioners for more providers in Archuleta County. Odowski et al. 2021 showed that rural nursing BSN attainment is about 30%, and that's significantly lower than the 45% among their urban-based nurses. BSN routinely demonstrates stronger critical thinking, which drives improved patient care outcomes and lowers costs. This is essential for rural hospitals that have broadened patient populations and run on thinner margins. BSN prepared nurses can provide needed clinical leadership and nursing leadership for Pagosa Springs Medical Center. The MSN and DNP programs can create program stability while reducing health inequities in Archuleta County, and bringing in these local partners such as PSMC and PCC creates trust, which helps with student retention and decreases new nursing turnover. This is a two-phase plan. Phase one is to develop a high-fidelity simulation lab at PSMC and to launch this in the summer or fall of next year. These capital expenses are going to be minimal to Pagosa Springs Medical Center and the other parties involved because they are covered by grants such as the 2026 Nurse Education Practice Quality and Retention Grant, or the Transition to Practice program. This is an exciting grant to leverage because it was designed to strengthen workforce development in innovative educational and clinical training opportunities in traditional and non-traditional settings in order to reduce health inequities in rural areas. In short, we're doing something new and innovative in a rural area to expand a workforce development pipeline. Secondly, it leverages idle resources. Pagosa Springs Medical Center has some space available and a $3.1 million operational deficit. This approach utilizes that empty space that's not making them any money and turns it into a grant funding machine. And finally, it decreases nursing turnover and increases retention. Similar programs have seen 5% less nursing turnover and a 25% increase in new grad hires, and have built pathways for existing staff development, which leads to greater retention. So why nursing education and nursing educators? In short, nursing educators can leverage grant funding that can redefine how rural hospital systems attract, train, and retains talent. And this is huge. At the American Hospital Association's 2026 Rural Healthcare Leadership Conference, they examined how successful hospital systems were shifting from reactive survival strategies to proactive transformation by investing in 5 key areas. The first, workforce innovation. Second, care model redesign. Third, digital transformation. 4, strategic partnerships. And the 5th was governance and leadership. They found that rural hospitals are shifting from competing for scarce talent to actively producing and sustaining their workforce. By building local pipelines, redesigning training and roles, and leveraging technology, they are creating durable workforce models that improve retention, expand capacity, and support long term. Nursing educators and nurse practitioners are keys to this process. We already explored phase one, and that is to launch the high fidelity simulation lab. Phase two is to deepen the long term impact and return on investment for the key shareholders. High fidelity simulators lead to better patient care outcomes for physicians, nurses, EMTs, and other allied health professionals, according to the research. A high fidelity simulator can be used by local schools to stimulate interest in health sciences, boosting enrollment. Fire rescue, respiratory therapy, and existing clinical staff can also use it for specialized training. Opportunities for learning and professional development, such as BSN and Advanced Registered Nurse Practitioner tracks, have been shown to reduce turnover for rural nurses. Grants to the HRSA can further assist in developing graduate level providers, helping to fulfill multiple provider openings at PSMC, and supporting locally grown educators and practitioners to keep the program sustainable and improve healthcare access and equity. So let's explore some oppositional concerns or questions. Why can't students go to Fort Lewis College? Well, Fort Lewis College is a great school with a good nursing program, but it lacks capacity. They're full. It also requires 2.5 hours of round trip commute for the students in Pagosa Springs. CSU Pueblo does have a rural template that's been proven in Walsenburg and elsewhere. They have grant expertise, graduate pathways for nurse practitioners and nursing educators, and an existing dual enrolled ADN and BSN program with PCC. Will it cost too much? Well, maybe not. High fidelity simulators are looking at about $150,000 and then probably some additional build out costs. But grants should be able to cover the majority of this infrastructure. And Pagosa Springs Medical Center can leverage idle assets that aren't making them any money, into grant funding. So that makes money out of nothing. And then finally, limited enrollment's going to cause it to fail. Yes, this is a weak part for these types of rural development plans. However, tuition reimbursement, intentionally leveling up EMTs and allied health providers like CNAs to the level of registered nursing, and targeting existing staff and high school seniors have been proven successful in other rural markets. Allowing Pagosa Springs Medical Center to be the face of the program and the host also helps leverage that needed community connection. In short, this approach doesn't build competition, it builds capacity while working together. I won't go through all of the next steps and proposed project timeline here, but the next key steps here would be to meet with Dr. Kathleen Morris. She's the dean at CSU Pueblo School of Nursing, to get her to greenlight this idea, and then have a conversation with Pagosa Springs Medical Center CEO, Dr. Linda Webb, and their board of directors. You can see other areas and key highlights where we would be completing a memorandum of understanding, reaching out to develop additional community stakeholders, improving and expanding on that memorandum of understanding, applying for grants, begin a public awareness campaign, purchasing those simulators, seeking to recruit students for admission consideration to a fall 2027 cohort. And complete the lab setup, have some open houses, school career days, and so forth, and hopefully in the fall of 2027 launch its first cohort at the PCC/CSU Pueblo Pagosa Springs Medical Center satellite campus. So the letter assignment that I did was to reach out to Pagosa Springs Medical Center CEO Dr. Rhonda Webb, inviting her to explore a vision to help Pagosa Springs Medical Center regain its financial footing and to deal with that $3.1 million deficit, which has been largely driven by travel nurse salaries, according to their board's research. The second is to build a healthcare leadership development pipeline for healthcare workforce stability. The third is to provide more nurses, nurse educators, and nurse practitioners for southwestern Colorado. And fourth, most importantly, is to reduce healthcare disparities in Pagosa Springs and Archuleta County. The next step that I need to do is to share this vision with Dean Morris if it seems like this is something that would be feasible and interesting for other parties to be a part of. For information about this strategic partnership proposal, I invite you to get in touch with me. My email there is on the screen, bm.keller@pac.csupueblo.edu. And as I said, this proposal could be for any rural hospital. And I've got some resources here. Some of these references speak directly to the current challenges facing Pagosa Springs, while others provide background on rural nurse recruitment strategies and best practices for academic practice partnerships. So this vision could easily be shared or modified to address the needs of other critical access hospitals facing similar challenges and budget crises. Thank you so much for joining me today and letting me share with you a project that I'm passionate about. And I hope that an idea like this might stimulate some thinking for a community or critical access hospital that is close to your heart.